Sports Injury Webinar by Joseph Muffolini. So the injury I chose to report on is a dislocated shoulder. A dislocated shoulder occurs when the upper arm bone, the humerus, pops out of the shoulder socket, the glenoid. This can happen due to various reasons, including trauma and overuse. Some symptoms include intense pain in the shoulder area, swelling and bruising around the shoulder, limited range of motion in the shoulder joint. Visible deformity and bulging in the shoulder area indicating a dislocation. Now, the name of any muscles or bones affected. For muscles, the muscles commonly involved include the rotator cuff muscles, the supraspinatus, the infraspinatus, the teres minor, and the subscapularis, and the muscles around the shoulder blades, such as the rhombus and the serratus anterior. The ligaments, however, that may be injured during a shoulder dislocation include the glenohumeral ligaments, which help stabilize the shoulder joint, particularly the inferior glenohumeral ligament. Tendons that can be affected include those of the rotator cuff muscles, as they can tear or become strained during the dislocation, as you can see in the image on the right. The most common cause of a shoulder dislocation is trauma, often from a fall onto an outstretched arm or from a direct blow to the shoulder. Sports injuries, particularly in contact sports like football or rugby, can also lead to shoulder dislocations. As you can see in the picture, the person dislocates a shoulder by blunt force trauma. Now, complications of a shoulder dislocation may include recurrent dislocations. Once a shoulder has been dislocated, it's more prone to future dislocations. I can speak for personal experience, as this is pretty annoying and your shoulder always feels like it's going to dislocate after. Second would be labral tears. The labrum is a ring of cartilage that surrounds the socket of the shoulder joint. It can be torn during a dislocation, leading to instability and further complications. And lastly, and the most important complication, would be nerve or blood vessel injury. In severe cases, nerves or blood vessels around the shoulder can be damaged during dislocation, leading to numbness, weakness, or other permanent complications. The estimated healing and recovery time for a dislocated shoulder can vary depending on the severity of the injury and whether there are associated complications. Generally, it can take several weeks to months for the shoulder to heal completely. However, it's essential to follow medical advice and undergo rehabilitation to prevent further injury and promote proper healing. A basic shoulder dislocation may take anywhere from a month to 6 weeks, but if there's more severity problems and there's more severe ligament and muscle tears, then it could be even 12 to 14. Recovery exercises. Physiotherapy exercises play a crucial role in the recovery process. Here are some recommended exercises. Pendulum exercises. These gentle exercises help improve range of motion in the shoulder joint without putting too much stress on it. They involve letting the arm hang loosely and making small circles back and forth movements, like the girl in the red dress. Passive and active range of motion exercises. These exercises involve gently moving the shoulder joint through its range of motion. Initially, passive exercises may be done with the assistance of a therapist, and as healing progresses, active exercises can be introduced. Once you feel better, you would start getting into strengthening exercises. As the shoulder starts to heal, strengthening exercises targeting the muscles around the shoulder joint, especially the rotator cuff muscles, can help improve stability and prevent future dislocations. Examples include internal and external rotation exercises with resistance bands or light weights. As the guy in the black shirt using a resistance band, those are very good for the muscles and they target the little ligaments to strengthen the shoulder. Scapular stabilization exercise. Strengthening the muscles that support the shoulder blade, the scapula, can help improve overall shoulder stability. Exercises such as scapular retractions and shoulder blade squeezes can be beneficial.